DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. I'm glad that you joined me. We're going to talk about something that's very common that every year we talk about vaccinating for Lepto and vibrio when we're doing our cow work or we're doing pre-breeding shots or things like that with our replacement heifers. So stay tuned. We're going to have a discussion on what's in the bottle.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Kansas Farm Bureau has served farm families and rural Kansas for more than 100 years, and we're pleased to offer new healthcare coverage choices for Kansans in 2020 through Kansas Farm Bureau health plans. No matter what stage of life you're in, we'll have options that fit your lifestyle. Plus, our network of providers is one of the largest available throughout the state of Kansas and beyond. For more information, including the different plans available, or to get a quote, visit kfbhealthplans.com.
Closed captioning brought to you by Vet Gun with Amel and new AMA Abamectin Vet Caps, the 1-2 punch against hornfly resistance from AgriLabs.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson. I'm here at Kansas State University where I serve as the Jones Professor of Clinical Epidemiology and spend a lot of time with our beef producers, with beef packers and retailers throughout the industry, and I'm very proud of what we do. And when we start to talk about sustainability and we start to talk about different things within the beef industry on how we're going to preserve our natural resources, you know, getting those cows bred, getting a calf on the ground, getting that calf weaned, getting it to the packer is all part of judicious or just good production management. And when we talk about preventative medicine, we talk a lot about biosecurity. And biosecurity is not tracking some disease in, the prevention of exposing animals to a disease, and if they are exposed, making sure that they're vaccinated properly so that they can fight off the infection or fight off the exposure to that pathogen. Every year when we get together to talk about vaccinating cows, you know, we talk about our 5-wave viral, which is IBR, BVD, PI3, and BRSV, but the other component that we usually vaccinate for reproductive disease is we hear, well, we better give them a Lepto vibrio. And same goes with our bulls. And really, Lepto and vibrio are two bacterial infections that cause abortions, that can cause issues in cows, they can cause issues in reproductive or venereal diseases being passed from bulls to cows. And so when I start to think about these two, I think of Lepto being more of one that is harbored in the cows, harbored in wildlife. Rats can carry Lepto. There are 5 different strains of Leptospira bacteria. Harjo and Pomona being the 2 biggest ones that we contend with in the beef industry. And when I think about Lepto, I think more of cows being exposed from the environment where deer can carry Lepto, rats, different animals, dogs can carry Lepto, and if they urinate in the water or if the water source becomes contaminated, then the animals that drink that can be exposed to lepto. Vibrio, on the other hand, is a Campylobacter bacteria, which that doesn't mean a whole lot, except that's the genus that it comes from. But the exposure of Vibrio or Campylobacter is more of an animal-to-animal contamination or exposure. So I think that when we think about vaccination and timing, we have to understand that animals in the South and in different places geographically are being exposed all the time, that water's available in ponds, rivers, and creeks to lepto. And really, we need to target, when we think about Vibrio, is vaccinating at the point in time of reproduction, or when we turn the bulls out with the cows. Many different things to talk about. Obviously, always work with your veterinarian, but when we come back, we're going to talk a little bit more about these two culprits that can cause us issues. What are some of the clinical signs? And we'll talk a little bit about some of the things and discussions you should have with your veterinarian on timing. Thanks for watching Doc Talk. We'll be right back. Hey folks, welcome to our Cattle First Minute. I'm Dr. Dan here, and thanks to Beringer Ingelheim Vet Medica for sponsoring this. When we think about vaccination and vaccinating calves in the fall, or vaccinating your cows in the fall, or summer, or spring, it doesn't matter what time of year, we've got to treat vaccines responsibly. Because if you don't, that modified live vaccine becomes a modified dead vaccine. We want to make sure we keep it out of the sunlight. We want to make sure that we keep it cool. We want to make sure that you don't mix up more vaccine that you're going to utilize than what you would utilize in an hour. And when you do, make sure you put it in that cooler that keeps it dark and keeps it cool. All of these things, understanding that the syringes have to be clean so that these products work well. Putting a vaccine that is not efficacious into an animal means you vaccinate the animal, but you don't immunize the animal. And understanding that there's a difference between immunization and vaccination is important for Cattle First.
Sure Crop Fertilizers was started by my father, Don Sherman, and my mother, Shirley Sherman. Family business is started in the 80s. We predominantly focus on plant nutrients and what we can do to give growers better responses with the fertilizer dollars that they do, and what we can do to make those things work better for the grower. We're based out of Seneca, Kansas. We work with growers in their soil analysis to figure out what they need, and then we can put those in a blend that gives them the best results, and so that we can deliver that direct to their farm so that they have those nutrients where they need them, when they need them, and so that they can apply them in a manner that's very efficient to them and works well on their planting systems and what they're doing. Sure Crop Fertilizers has been around for a long time. We always say we're big enough to take care of everything you need, but we're small enough to do it quickly. You can get a hold of us at 1-800-635-4743. Our website is surecropfertilizers.com, and you can always email me at Corey@surecropfertilizers.com, and with any questions you have, and we're glad to answer and work with you.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here at Kansas State University, and we're talking about cow reproduction and specifically about diseases associated with cow reproduction. When we start to think about leptospirosis and vibriosis, or caused by Campylobacter species, we really need to understand what are some of the things that we will notice. So what are some of the clinical signs? And the tough part about lepto is that cows or bulls can become carriers, and they can, their immune system can kind of or Lepto can kind of trick the immune system and stay in the animal undetected by the immune system for 5-6 months. And so that animal is actually then urinating Lepto. It has Lepto in its mucous membranes, and so it is contributing to the exposure of other animals through the environment. The other thing is to understand is that it's estimated that 50% of our herds have a leptopositive animal within the herd. So it is something that is quite common in our beef herds, and the other ingredient to that is, depending on where you are, the amount of time of exposure in which those cows are exposed to Lepto can be different, because if you live in the South where it doesn't freeze and you always have running water and ponds, those animals are constantly exposed year-round to Lepto through the water, through the environment. And so understanding that Lepto is something that is carried by animals, 50% of our herds have Lepto, and understanding that Lepto in our southern regions is more of a year-long exposure, where in the northern regions we don't have that exposure year-long because of the hard freeze. Vibriosis, on the other hand, is what we talk about as being a venereal disease, where it is passed from an infected bull to a naive heifer or a naive cow. And this is really something that we need to control through our vaccinations. When we start to see clinical signs, what are some of the clinical signs associated? With Vibrio, early embryonic death or early abortion in cows is more common than with Lepto. A lot of times Lepto will not show up as a large outbreak of abortions, but Vibrio will show up the most common clinical sign is all of a sudden we have cows coming back into heat 3 to 5 months after first exposure to the bull. So early embryonic death, cows coming back into heat is something that would be a big concern, especially if you have more than 10% of your herd that is coming back into heat at that 3 to 5 months post first exposure to that bull. We're going to start to think about early embryonic death and subsequent animal cycling again. With Lepto, it's the abortion rate with Harjo infections rarely goes over 10%, but with Pomona infections it can be higher. At the end of the day, if you think that you're having abortion issues in your cows, or if you're having exceedingly number of open cows, get with your veterinarian, and we're going to talk about the testing that we can do right after these messages.
When you're in the cattle business, no matter how much it's a business, it still starts with cattle. It's this basic notion that sits at the core of how we approach things at Boehringer Ingelheim. We understand when you put the cattle first, it just naturally leads to doing the right things. If you want to do well in this business, you start by doing right. Take care of the cattle, and they'll take care of you.
Kim Mannering with Hardy Insurance. Today we will talk about employee safety and work comp coverage. On your farm, do you ask your friends to come help? Are they considered employees or neighbors helping neighbors? Did you know that you can be held responsible just as if it's a work comp accident? Give me a call, we can discuss. 316-945-6733.
Long-term medication, even though we have medications now that are exceptionally safe, especially for senior animals, they come with a cost. So you figure you're going to run about $2.25, depending on the medication that you choose to use, $2 to $3 a day. And so if you're gonna spend $100 a month, but what I tell my owners is that once you've gone down that road of utilizing pain medication and the dog's doing great on it, and they can't feel it, you can't stop. You pull them off of it, they're gonna be worse. So you have to keep going. So you have to commit to yourself that, hey, I'm gonna do this medication, I'm gonna keep it going, and I'm never gonna stop. With this, there's really no commitment. It's like, okay, we did this. If this works, great. If there's a condition that maybe it didn't work so much for, or maybe there was some compliance issue or something happened, we're not stuck in any way, shape, or form. We can go to another modality if we feel it's appropriate. But in this instance, I think we're onto something, at least with this therapy, at least from our judgment, that has done really well, because we have not yet had a dog come back. We have not repeated an injection. We have not had a complaint. And the dogs that have come back into our office, it is really hard to tell where the lameness was.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey there, folks. Welcome back to DocTalk. Dr. Dan Thompson, and we're talking about lepto and vibrio in cows, and specifically the vaccination and control. But if we start to think that we're having an issue with early embryonic death or abortions in cows due to lepto or vibrio, or due to anything, the first things that we have to rule out is, did those cows get pregnant to begin with? And there we're going to be looking at the things that are most common, body condition score, are the animals cycling, viral pathogens and things to that nature as well. But if we start to see increase in abortions, and a low number is normal, but when we start to see excess of 5-10%, the first thing we want to do is get your veterinarian involved, because the veterinarian has a relationship with the diagnostic lab. The veterinarian also is dealing with other types of abortions and different reproductive strategies within your area. So they might know if they're seeing an increased case of lepto or increased case of vibrio. Maybe we're having a drought, or maybe we're having excessive rainfall. All of these different things can change where animals drink, where wildlife drink. It can concentrate animals. So having that understanding is important. But the first thing when we have these abortions, and a lot of times with early embryonic death or early term abortions, you're not going to see anything. You're not going to see slunks or fetuses being expelled. You're going to just have open cows, and we've discussed that earlier. If we start to have late term abortions where we're seeing hairless fetuses or fetuses being aborted, then we want to send in, there's a couple of different things we want to do. On early embryonic death, the first thing we want to do is take some vaginal cultures, and we can send those in. Campylobacter or vibrio does not last very long in the environment, so these tests have to be done. They have to get the swab on media right away. If we're seeing late-term abortions, we want to send in the fetus. We want to send in the placenta if possible. We then want to, in both early term or late term abortions, we want to take blood samples of the cows. And so these will tell us if we have antibody responses. And with the new technology, with PCR and some of our rapid diagnostics, it's very easy for us to find lepto, vibrio, and it's easy for us to identify whether or not the lepto or vibrio that's present within the cow or within the fetus, whether that is the vaccine strain or whether that's a wild type exposure type strain. So there's a difference in what you're going to see clinically from early term versus late term. Early term, you're going to see open cows. You're going to see cows that are cycling at 3 to 5 months post exposure to the bull. With late term, you're going to see the fetuses and the placentas that are expelled, and both of those have different types of strategies in diagnostics. Make sure that you work with your local veterinarian so that you can get blood samples from the cow, so that you can have differentiation if there's a septic type infection, or to look at the serology to see the increases in titer to the different species that could be causing abortions. When we come back, we'll talk a little bit about vaccine strategy with Lepto and Vibrio. You're watching DocTalk. Thanks for joining us.
What if sustainability were synonymous with U.S. soy? If energy efficiency, water quality, and soil health help define U.S. soy's value, that future is here, the time is now. To meet end-user demands, the soybean checkoff is committing to sustainability that's achievable, worthwhile, and enduring. A message from the Kansas Soybean Commission, the Soybean Checkoff. Progress powered by Kansas farmers.
The elements can be relentless. Make sure they have respiratory protection to match.
When it comes to stopping horn flies, cattlemen love their Vet Gun. Today they love it even more because Vet Gun now has a 1-2 punch with 2 VetCap insecticides. New AIM-A abamectin can be used in rotation with AIM-L for effective in-season control. Each delivers a unique mode of action to manage hornfly resistance. So start your in-season rotation program with AIM-L and new AIM-A abamectin VetCaps from AgriLabs.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey there, folks. Welcome back to DocTalk. I'm Dr. Dan Thompson, and we're here talking about Lepto and Vibrio in cows and bulls. And the first thing is, if you're having abortions or if you're having issues, one of the things we need to do within the herd is work with your veterinarian to clean up those infections or treat the animals in which are having these bacterial infections. And there are different antibiotics that will work routinely to help treat these animals, and there are different types of ways in which we can treat bulls that are positive for Vibrio that working with your veterinarian can be quite successful. Now, the prevention. A lot of times people say, well, when are we going to vaccinate our cows? And the answer to that is when we catch them, right? And so we have times in which when we do pregnancy testing and weaning. We have times when we do our branding and pre-breeding shots for calves in the spring. And I think that our timing let's break this into 2 groups. First are our replacement heifers, and the replacement heifers or new young bulls coming into the herd, we want to vaccinate those animals twice for Lepto and Vibrio. We'll do it once at weaning, and then at 20 to 40 days post first vaccination, we will give those animals a revac or a booster or second vaccination for Lepto and Vibrio. That would be the same for replacement heifers or for replacement bulls. After that, we have annual boosters. And when we start to think about this as far as a pre-breeding shot, or this being a reproductive disease, the best time to vaccinate these animals to get the proper immune response would be at that time of branding or the time of right before we turn them out to grass, before we AI them, or before we are going to expose them to bulls. So best timing is going to be 30 to 60 days pre-breeding for cows and for heifers on our annual booster. When we think about this disease and you think about biosecurity, we know that we're having more and more confinement cow-calf operations. And the more confinement or the more confined these animals are, the more important it is to make sure that we vaccinate. The vaccination and the different things that we utilize are only as good as making sure that we don't have some sort of overwhelming exposure. There are things that you need to think about with making sure we have clean water tanks, that we clean the bedding and the straw out of these confinement operations. If you're using artificial insemination, you want to make sure that you have your equipment is cleaned and that you aren't exposing from cow to cow different types of diseases vaginally. So making sure that we have a clean environment, making sure that we have a clean equipment is vitally important to the biosecurity of any of these reproductive diseases within the cow herd. Lastly, vaccination in heifers. We want to do that 60 and 30 days pre-breeding. In cows, our annual booster will give that booster at the time of pre-breeding when we're branding those calves. Thanks for watching DocTalk. I'm Dr. Dan Thompson. If you want to know more about what we do here at DocTalk, you can find us on the web at www.doctalktv.com. Always work with your local veterinarian, and I'll see you down the road.
Closed captioning brought to you by VetGun with Amel and new AMA Apomectin Vet Caps, the 1-2 punch against hornfly resistance from AgriLabs.
For more information about this program or previous programs, go to DocTalkTV.com.
DocTalk was brought to you by Merck Animal Health, the science of healthier animals.
Kansas Farm Bureau has served farm families in rural Kansas for more than 100 years. We're pleased to offer new healthcare coverage choices for Kansans in 2020 through Kansas Farm Bureau Health Plans. No matter what stage of life you're in, we'll have options that fit your lifestyle. Plus, our network of providers is one of the largest available throughout the state of Kansas and beyond. For more information, including the different plans available, or to get a quote, visit kfbhealthplans.com.
I had this horse. It was a good horse, except for when the wind was blowing above 30 miles an hour. The wind was blowing about 35, 40, and I saddled him up, rode him out to the end of the lane, and I thought, well, he's doing pretty good. And about 6 jumps later, I was laying on the ground and thinking, boy, my shoulder sure hurt. I kept waiting, and it didn't get better, and so I went to orthopedic surgeon, and that showed that I had torn rotator cuff. And said, well, we'll have to do surgery. I thought, I farm and ranch by myself. This is not going to work out very well. I'd been sleeping in my recliner for about 2.5 years because it hurt too much to sleep in bed on my side. I'd heard about Kansas Regenerative Medicine Center on the radio. Gotten down there at 8 o'clock in the morning, and by 11:30 the procedure was all over. They just took some fat out of my side here and spun that down for about 45 minutes and then injected it in my shoulders, and I was on my way. It's something you don't hear about, but I thought it was worth a try, and I'm really pleased. It's really worked out well for me.
Kansas Corn reminds you that E15 fuel is the right choice for every kind of driver. For the car enthusiast, E15 has higher octane. For the thrifty driver, E15 is priced lower than regular unleaded. For the nature lover, E15 provides cleaner air. For the shopper who buys local, E15 has more ethanol from our Kansas corn farms. Choose E15 for a higher octane, lower price, cleaner American fuel. Message from the Kansas Corn Commission. Learn more at kscorn.com.